Start.
Hello everyone. Now in this video we will learn about the mechanism of labor in a breech presentation. In a breech presentation, the lie is longitudinal. The presenting part is the podalic pole, which are the buttocks that overlie the lower pole of the uterus. Denominator, the bony prominence, is the sacrum. The position, most common position, is left sacrum anterior. Is the left sacrum anterior, which is the most common position, where the sacrum faces the left iliopubic eminence. Next followed by the right sacrum anterior, which is the second most common position, where the sacrum faces the right iliopubic eminence, and followed by the right sacro-posterior, where the sacrum faces the right sacroiliac joint, and the left sacro-posterior, where the sacrum faces the left sacroiliac joint. In this video, we will learn about the mechanism of labor in case of a complete breech or a flexed breech in left sacroanterior position. The cardinal movements in breech presentation occurs at three places. One is the buttocks, the next shoulder, and the next in the delivery of the head. Buttocks and shoulder, though bigger parts, are more compressible and the delivery is easy, unlike the head, which is, though smaller in part, it is a non-compressible part, and due to non-moulding as a result of rapid descent, faces difficulty during delivery. So each of these three components undergo cardinal movements as in normal labor. First, coming to the delivery of the breech. Engagement of the buttocks. Buttocks engage in one of the oblique diameter of the inlet. So in left sacro-anterior, it engages in the left oblique diameter, which extends from the left sacroiliac joint to the right iliopubic eminence. The engaging diameter is the bitrochanteric diameter, which is 10 centimeters. When this diameter passes the inlet, the breech is said to be engaged. After engagement occurs descent. Descent occurs until the anterior buttock touches the pelvic floor, and then occurs internal rotation through 1/8 of the circle. Here, internal rotation occurs at the level of the anterior buttock, and the anterior buttock comes under the pubic symphysis. Further descent and lateral flexion of the trunk occurs until the anterior hip hinges under the pubic symphysis, which is released first, followed by the posterior hip. Then follows the delivery of the trunk and the lower limbs, after which occurs the restitution. So with this restitution, the next part engages, which is the shoulder. Soon after delivery of the breech, the shoulder engages in the same oblique diameter as that of the breech. In this condition, this is the left oblique diameter. The engaging diameter in shoulder is the bisacromial diameter, which is 12 centimeters. Descent along with internal rotation occurs such that the shoulder now lies in the AP diameter. Simultaneously, the trunk also rotates through 1/8 of the circle. With anterior flexion of the trunk, the posterior shoulder is delivered first, followed by the anterior shoulder. Following delivery of the shoulders, restitution and external rotation occurs by 1/8 of the circle, such that the trunk comes dorso-anterior. With this, the next part comes to engage, which is the head. The head engages in the right oblique diameter, and the engaging diameter is the suboccipito-frontal diameter. Head engages in the right oblique diameter, and the engaging diameter is the suboccipito-frontal diameter. After this, descent and increasing flexion occurs, and internal rotation by 1/8 of the circle occurs such that the head hinges under the pubic symphysis and the head is borne by flexion.